Greetings to all of you physically distancing Herle Burlyites. I thank you for tuning into the pod this week, or alone, or with at least 6 feet of separation between you and the next closest listener. I'm so happy to say that our presenting sponsor, TELUS, are not distancing themselves from the pod or Canadians during these challenging times. Actually, they're doubling down. Whether it's providing frontline healthcare workers and vulnerable populations with supplies and technology that'll help keep them safe, or supporting people who are isolated and at risk with virtual healthcare and mental wellness support, TELUS will do whatever's required to help during the crisis. As Canada's largest health IT provider, providing electronic medical records and consumer health services to Canadians, along with the digital backbone to support doctors and pharmacists, they just feel it's their duty to step up right now. General, routine health needs don't disappear in the face of a pandemic. So to help Canadians safe and reduce exposure for themselves and others, TELUS has expanded their virtual healthcare capabilities. One of the ways is through their Akira Virtual Care app, which enables users to virtually connect with a health practitioner 24/7, 365 days a year, and can help further alleviate strain on our clinics and hospitals. In addition, a number of TELUS Health for Good mobile clinics have been deployed in their communities to help in any way they can. For the latest information about TELUS's support during the crisis, visit TELUS.com/COVID19. That's TELUS.com/COVID19. Hey there, Herle Burlyites. We're on the show now. Welcome to the second edition of the physically distanced Herle Burly, available wherever you listen to your podcasts or on YouTube as a co-video conference. I, David Herle, have learned a lot since last week's pod. Specifically, I've learned where the mute button is, which I think will come as welcome news for the 38 people who reached out to me privately, or for everybody to see on Twitter, about my personal sounds. I thank you for your honesty. So this week's Herle Burly, now with 85% less coffee drinking, lip smacking, and other body noises. This is a special pod in 2 parts today because of the circumstances that we're in. We're going to open with a one-on-one interview with Scott Clark. A longtime public servant, Scott was the Deputy Minister of Finance when the budget was first balanced in the 90s. I know him as a very creative policy thinker. Things like the RASP and Canada Education Savings Grant or the Canada Foundation for Innovation wouldn't exist without Scott Clark. He's a creative policy thinker, and along with his colleague Peter DeVries, has been providing insider analysis of economic policy for the last decade. We'll do a deep dive on the economic impact of COVID-19 and the government's unprecedented response. After Scott Clark, we'll immediately bring in our political panel, Jenni, Byrne, and Scott Reid, to talk more about all that and the politics of this crisis. So, Scott Clark, first of all, welcome to the podcast. Thank you for agreeing to come on.
Thank you for inviting me.
Well, and this time you're not paying me, so you won't be able to tell me to shut up.
Never. Maybe at one time, but not now.
All right, Scott. So you're sitting in the chair of Deputy Minister of Finance, and there are 1 million applicants for EI in 1 week, and you are putting in place measures that are effectively shutting down the Canadian economy. Fair to say that nobody in public life or public policy has ever seen anything like this in our lifetime. So how would let's start with this. How would government respond to a crisis like
that? That's a good question, because I think it's fair to say at least 4 months ago or before Christmas, this particular virus, this crisis we're in now, was on nobody's radar, right? So it began to appear in China. We began to see it in Italy and places. So it takes a while, I think, for people to really realize how serious the problem was and could become. And I expect what probably happened in Ottawa, and I hope would have been that the Privy Council office, which is the Prime Minister's personal secretariat, would have seen this happening. Their job is to bring together the policymakers and thinkers, so to speak, and begin to craft solutions to the situation. And that might have been, the senior officials of finance and various other departments and the Privy Council office to begin to draft a plan that cabinet could consider. And I think what became pretty obvious probably to them and to others is this was moving at light speed, right? This wasn't time where you could sit back and say, give me a report in 2 weeks. 2 weeks was not in the question. Although I think it may have been a while before they realized how fast this virus could become such a serious problem. And I think the other thing was, as you said, David, no one had ever seen anything like this. I mean, I've lived through lots of recessions and one financial crisis, but this was a new experience, a supply side shock to the economy coming from a deadly virus. And how do you respond? What is the right response to this? And I think it took a while. And unfortunately, I think the Canadian government did a good job, certainly compared to the United States, is that they were able to quickly realize that the frontline policy response was the healthcare system, the specialists, the scientists, the doctors, and also that we needed a coordinated response where all levels of government would buy into that strategy of trying to contain the virus. I heard a great analogy the other day where the policy response was like putting the economy into a coma, right? And then you put the economy into a coma, like an individual who was ill, in order to find ways to cure the illness that is attacking the body. And I think right now that the Canadian economy is in a coma, could be for another few weeks, while the frontline health workers and Canadians, by following the recommendations of governments to stay home, to wash your hands, physical distancing, self-isolation, and quarantining, you follow those recommendations, and then that frontline defense is the best economic policy we can have. And the scientists will have to tell us when we can begin to take the economy out of its coma.
So we are in fully uncharted territory.
Absolutely.
How do governments deal with fully uncharted territory?
I think they probably feel pretty nervous. And I think there's been some criticism. Well, why didn't they do this? Why didn't they do that? Why didn't they do faster? Look, I think given bureaucracy, David, and the speed of bureaucracy, I'm amazed that they were able to do as much as they did and the shortest time that they did it in. It wasn't always perfect, right? I mean, it wasn't perfect to propose a 10% wage subsidy, and I'm surprised they wasted time with that. But I think they got the policy mix right in trying to keep the pieces of the economy together, right? To maintain the employee-employer relationships, to provide income support to those who needed it during this really uncertain period. No one knows how long this is going to last, right? Or how deep or serious it could become. But it's uncharted, and every day you sit there and the health experts have to tell us what's happening and how far we have to go. So for policymakers sitting in Ottawa or Toronto or anywhere else, they're waiting every day to get the facts, to get the data. And even the data is different now, right? Now it's how many infections, how many deaths, what's happening, right? It's not what the unemployment rate is doing. I don't care what it's doing. It's not what interest rates are doing. Nothing like that, right? It's all about the healthcare system and what is happening there.
Right. On the economic side, you sound impressed with how quickly they have moved. You noted the 10% thing, but generally you sound pretty complimentary about how quickly they've moved on income support and other measures in the economy. What would you say about the observation that they generally seem to be a week or 10 days behind the most bold countries on this front? For instance, UK did its wage subsidy 10 days 2 weeks ago.
I think that's valid, but think about what you just said. The UK did it, 2 weeks ago, right? those are the, if you said 2 months ago, but 2 weeks ago, I mean, I think you might have said in Ottawa when this was happening, and with looking backwards, well, 10% was ridiculous, and if you're consulting with anyone in the small business community, they would have said it's ridiculous and you shouldn't have wasted time. I think the second one was, you should have known that the number of EI applicants would skyrocket and that the system, the normal system and how it operates, couldn't have handled that, right? I think those are observations that I would make from the outside, but not being on the inside, David. And you know, when you're on the inside, your perspective is entirely different. And so right. when they then responded with the new, the CERB, right, the temporary $2,000 a month, that was to provide a transition to EI. Now, though, effectively with a 75% wage subsidy, the government has become the employer of the country, right? This is open to everybody. So for some period of time, the government's paying the wages of everybody in the economy, 75% at least, up to whatever that cap is of 58,000 or something like that, right? So that makes the government an employer, right? And it's probably the most generous of the options available to workers and employers, small business operators. If they can find out how it's going to operate, and we're still waiting, I think today there'll be more information. And that becomes the issue for the government now. How quick can you get this thing working? People are becoming kind of like, how do I do this? The employer, how do I get the wage subsidy? Where do I go? Is it the CRA? Where do I go to get this thing happening? I think that's the question that a lot of people are asking right now.
Why do governments make you apply for things that ought to be automatic?
Well, a lot of things aren't automatic.
I mean, the issue that's always bothered me is the guaranteed income supplement. But this is now all these programs now, I mean, it really is difficult for people. I mean, business is one thing, but it's another thing for ordinary citizens to figure out how they ought to navigate this.
Yeah, I mean, I think probably these are all new programs, and therefore there's a bit of a learning curve, okay? But we have basically introduced a guaranteed income, right? Roughly $2,000 a month, right? And it was supposed to be easy to get, online application, you get the money within a very quick period of time. But it's still, that quick period of time turned out to be in the middle of April, right? So because you don't have, none of these programs existed, you couldn't make them automatic. We do have a lot of automatic programs, as you know, David, in the government's fiscal structure. They're automatic. They work normally, right? But I think the government is kind of saying they've got to figure out how to make them work in such a way that they work efficiently. So I hope they can make it quickly and not too complicated. Not too complicated.
Right.
Okay.
So what is your assessment of their overall package, Scott? When you look at it, you described it as very generous. Do you think that they've generally struck the right note here?
I think they've struck the right note in the following sense. While we are with the frontline healthcare workers and Canadians generally fighting the battle to contain the virus, the goal of government was to provide income support. The economy's, these people, businesses and individuals are losing their businesses and their jobs by virtue of the government putting the economy into a coma, right? This is not a recession. I don't even like the word recession, given the way we usually use it, right? Where a recession has some other source. This is realizing the economy had to get fixed and then we could move on. And the job of government was to sort of put some glue in place, keep employers and employees connected, give income support to those who need it, who wouldn't qualify for an EI package, for example, in normal circumstances because they don't pay it. So they did a lot of things to sort of glue the pieces together. Maybe not as firm as we would like, but I think they did they've done a pretty good job. Now, the outstanding issue for small business is rents. You know, you hear it today, you know, they still have to pay their mortgages or usually rents or their hydro bills or their municipal taxes. Right. So, I don't know, that's provincial and municipal, okay? Rents are provincial, municipal is municipal. So there probably might see something there going forward.
Yeah, certainly. I know that renters are desperately looking for something more concrete from their provincial governments than they've been getting in most jurisdictions. I introduced you as the person who presided over the balancing of the budget in the 1990s. And how does a person like you, who drove that agenda then, and shrinking the size of government to what we could afford, and then ran surpluses for years after, how do you feel about a financial package, an economic policy package being introduced that the Prime Minister said, we don't know how much this costs?
I've seen that, and I've seen a lot of that. What it costs should not be a big issue. You know, the most important issue is the healthcare issue of the country, the health of the country. David, when I go back, and we're going back, you know, a lot of years, so I have to really get my memory working. And when we hit the crisis in '95, the deficit, as we understood it in those days, was just under 8% of gross domestic product. Debt was about almost 70%. And the crisis we faced, we had seen coming for decades. It's just that no one did anything really to bring it under control. But those are orders of magnitude. Before the virus hit, the federal government had a deficit of about 1% or 2% of GDP. And that's pretty small, right? And there were no problems or issues, and a debt ratio very low. And now it's skyrocketed. And I think you could see estimates. The parliamentary budget officer says it could be 113. His number was already out of date when he released his study. I think we're looking at 150 to 200 billion deficit. All this in a space of, 2 months? That's amazing, right? And we're not sure where that's going to end. But I guess 200 billion in a $2.4 trillion economy, I don't know, so a little under 10% of GDP. That's within history, at least 8% when we were around, David. But a debt ratio that's gone from 30%, to whatever, 80, 100% of GDP. So I think pretty soon how much it's going to cost matters. But he's constrained because we don't know how long it's going to take to contain the virus, flatten the curve, and allow the government to begin the transition of bringing the patient out of the coma. We don't know. We don't know whether that's going to be June, July, August, September, or next, whatever, right?
Or what that even looks like.
Or what that even looks like, exactly. I mean, this goes back to your point. This is all unknown territory for everyone, right? And yet, if you look at the UK or Italy or Spain or the US, we're all running huge fiscal deficits right now.
Right. Who's lending everybody all this money? In '95, it was said that people were starting to not want to lend us money. Who's lending all these governments all this money?
Well, nobody wanted to lend us money in '95 because they thought, these guys are crazy. They got a crisis and they don't want to do anything about it. So they had a huge risk premium laid upon us. They weren't going to buy Canadian bonds without a lot of compensation. Now here, who's going to lend us money? Well, I think internationally, there's a lot of liquidity in the markets, okay? And unfortunately, everyone's going to want to be borrowing. Right? We're going to have to borrow. Spain is going. The EU is going to have to borrow, and I don't think I think the world financial markets can handle it. And I think what's going to happen, just as back in '95 and all this stuff, is we're going to have to start borrowing. And if we want to compete with other countries in the financial markets to get the money, we have to show that we have a credible strategy in terms of getting the economy out of its coma, and a credible strategy of getting a handle on the overall fiscal issues that have resulted from this. And we're talking over a period of, David, of not just months, but years, because it's going to take some time, I think. But I think what's really key here to get people to lend to us is that the government has a credible, transparent strategy. And I hope, David, that they're already thinking about that now. All right? They have the pieces in place. Now's the time to start thinking, how do we start moving away? How and when can we start kind of getting people back to work, right? And that's another unknown. We've never had to look at the economy, which has been shut down completely, and begin to think, how do we restart this process? Because some things have changed, right? It's only going to be in 4 or 5 months, but some things are changing, and the world we lived in 4 months ago isn't going to be the world we're going to live in 4 months from now. And so we need a group of experts somewhere, hopefully with a lot of health experts, trying to put together a credible policy package. Now's the time. You got to be working on this right now.
Would you be using people inside government to do that, Scott, or would you be putting together an outside panel, or what would you be doing? I would be everybody, all hands on deck, so to speak. Okay, it's the private sector healthcare, the private, the scientists, the chief health officers, a lot of health people. People in government don't have a monopoly on what to do. There's just too many things going on in our society right now that a small group of people could do it on their own. I think the federal government and provincial governments inside, David, to use your term, they should take the lead to coordinate this effort and get it going. That's leadership that the government should be providing. Okay, so just back to the fiscal thing for one last thing.
Yeah.
We don't know when this is over.
Right.
So it could be a $200 billion deficit this year.
Yeah.
Can they sustain that a second year? Like, at some point, do we just have to take our lumps, or what? How does it work?
Well, I mean, sustain is an interesting way of putting it. Is you can sustain it if you can finance it. And again, I would be concerned if for some reason 200 became the new norm. I mean, it can't be the new norm, right? I mean, it's too large relative to the size of the economy, and it would eventually be too restrictive on doing other things that we would like to do. So, no, I think that we can't have a new norm of 10%. I think if you've got to bring it down substantially over time, and you have to do it in a credible fashion, using the best advice you can get. You just can't leave these things the way they are. I think part of the problem is things that the government has put in place, I see them as temporary. And some people are already saying, well, maybe some of them shouldn't be temporary, they should be permanent. Okay? And they're too expensive. Everything we've done is too expensive to make them permanent. It would basically take the agenda of any government and throw it out the window, right? I mean,
it has introduced to people the concept of a basic income.
Yes.
And that may be an idea whose time has come, right?
That's quite possible. And that should be on the table going forward in terms of this a panel of saying what new institutional or fiscal structure should we consider. I wouldn't like to see the government becoming a permanent payer of salaries, though, for example.
Right.
That the government is not the employer of the economy. The private sector is. That's the way it should be. But you're right. We introduced the concept of a minimum income, and we had to, and we did it quickly. And when times get tough, you act quickly, right? I mean, we know that. And so, maybe that is time to think about it, right? But you have to think about it in terms of.
Well, we kind of ended welfare in the 1990s, so maybe it's time to bring something like that back.
Well, it's time. it's time to think of something like that in conjunction with a lot of other related policies you might consider, right? That, it's one of we were considering a guaranteed income before. It's not new, okay? It just happened they got tested, in a war, so to speak, right? And it may work, but I think what you're going to find, David, is everyone's going to opt for the 75%, right? It's just a better deal. When you crunch the numbers, 75% is better than EI or the guaranteed income, okay? And
for sure, for anybody for whom it qualifies.
But what it does also is it keeps the employer and the employee together, so that when you're restarting, they're there together, right? The employer and the employee are there together, right?
Right.
That's
not to mention that in the midst of this crisis, the psychological toll that unemployment takes on people is huge.
It's huge because you don't know what's coming, right?
No,
you don't know what's going to happen to you.
No, I mean, this whole environment is dramatically more traumatic if you have no idea about your ability to survive it or sustain it economically, financially.
That's right. And I think back in 2008-9, in the so-called financial recession, it was deep, but people knew, right? They knew that we were going to come out of it fairly quickly, and we did. So the economy wasn't shaken up as much as it is today. I mean, all parts of our economy, all parts of the country are affected by this.
Right.
It's overwhelming.
Is it too early, Scott, for us to get a handle on what the impact on our standard of living is going to be as a consequence of this?
In the longer term, I don't know. I mean, I think it's probably too early. I think there are actually some positive efficiencies that could come out of this serious problem, and in the sense that working from home is going to be more efficient than going into an office. And that's a major change in the employer-employee relationship. And that may improve productivity and standards of living. Education, the way it's delivered, I think is going to change. Because school, the education system is seeing that you can teach remotely, right? You don't have to have classrooms. And so that changes the way families operate. It changes a lot of things that we're now entering into a territory which we have to sit back and what have we learned from all of this? I think standard of living depends on how well the patient survives the coma. Okay, if we can get out of the coma reasonably well, then I think we can get back on track. Okay, and that's the challenge. That's the challenge for governments. How do you wake up the patient and get the patient working and walking? That's, to me, the main challenge.
At the same time that they have to start pulling some money back.
Yes.
Right?
Well, once you get going, right? If you get people back to work, if you can restore some confidence in households and consumers and in businesses, then the thing will start to, it'll start to move along. It'll start to claw back. We'll start getting revenues, and you can start, fixing your fiscal balance. I guess the one point I would make is this is not just a domestic recovery, right? Our ability to recover and get going depends on the rest of the world as well. Depends on what's going on in Europe. Depends on what's going on in the UK. And most of all, it depends, unfortunately, on what's happening in the United States, right?
So as somebody who was a senior public official, can you give us a little bit of perspective on what it would be like to be trying to do your job, given the executive leadership that President Trump is providing to the government?
To his government?
How are the U's actually doing their jobs?
Well, I think the people in government right now are working probably 7 days a week, 14 hours a day. trying to understand what's going on. Certainly, that's what we all did. I mean, it's kind of all hands on deck, and you're trying to get facts, get information, and make decisions. Get politicians to make decisions. Get cabinets to make decisions. In the U.S., I don't know. If I was in the U.S., a senior public servant, I'd probably throw up my hands and just head to rural Montana.
Right.
I don't see how decisions get made in the U.S. And I suppose all we can say is that thank you, Dr. Fauci. I mean, they're in a serious, serious problem. I mean, they've not had good policy because they don't have good senior people in his cabinet or running his government departments. I think if in the federal government's case, I think the public service has done an admirable job. I think Canadians for years have had a first-class federal public service and first-class provincial public service. And I think the ability in this crisis that we're in for governments to get out quickly as possible and coordinate a policy response has been quite phenomenal. And that I can't underestimate that coordination and the leadership, okay? I also think, David, you're an expert on this, is I find the briefings, I don't care what people, the Prime Minister at 11 o'clock every day, followed by briefings with his ministers, followed by provincial updates, keeping people informed, being honest, telling really what's happening, and being transparent. I think that's been absolutely critical. And David, you have all the best policy.
And Canadians have rewarded their governments for it, Scott, with pretty high confidence ratings through this crisis. People are believing what the governments are telling them and listening to what the governments are telling them.
Well, I learned a long time ago, you can have the best policy in the world, but if you can't communicate it, it's going to fail, right? If you can't communicate to everybody in an understandable, transparent way what you're doing and why you're doing it and what you expect, then you're going to have a tough time. And I think you're right. And I think they deserve the positive polling that they're getting, right? Well, you take it when you can get it, David, because eventually that goes the other way, right?
I do know that, Scott. I do know that.
You know that, right?
Some of my lefty friends out there, Scott, are making the point that almost all of the people who've been identified as essential workers in our society are among the lowest paid workers in our society.
Yeah.
Do you sense anything might change as a consequence of this in that regard? Do you think maybe we'll take caregivers and personal support workers and nurses? Do we think we'll care about those people more and pay them more, value them more?
Well, I think I wouldn't want to be the government that tries to cut the salaries of nurses and doctors. Okay? And it is interesting like that. It's when something like this happens that you begin to see the value of others that you don't even, on a day-to-day basis, you wouldn't even recognize. Like a better example, David, is the people in grocery stores. The checkout people, and day in, day out, they're frontline workers. Okay, and I don't think they'd probably be lucky to get the minimum wage. And now you go to stores and people are cheering them. Right, they're cheering people checking out your groceries. People you wouldn't even think about. And I think it's done something for society to begin to look to your left and look to your right, your neighbors, and see, wow, we are a community. This is important. And we have to act as a community together and respect each other. So I think probably going forward, the issue, put it in economist terms, the relative wages of various people, well, I think there may be some rethinking. Take, even the gig economy, right? Which has become such a big part of our economy. People who have no benefits. Okay. How do they survive when they don't have health benefits, pension benefits, EI benefits? They have nothing. And now we know that. And we took them for granted. The person delivering your Chinese food or something, right? You say, thank you, you give them a couple of bucks and away they go. I think now getting your groceries delivered. These people do it, I'd like to think we've become a more empathetic. We have more empathy now to everybody. I hope.
I hope so too. And I hope it stays. Scott, thanks for joining us today. This was really great conversation.
Well, thanks for having me. I'm very honored to be on your podcast.
Well, and I'm honored that you came on.
Thank you.
Right. Say hi to Jocelyn for me, will you?
I will. Have a good panel. Okay.
Okay. Thanks.
Bye now.
If we've learned anything over the past few weeks, it's that in times of crisis, governments matter. So if you've never heard of Queen's Park Today, it's one of Ontario's most trusted news sources for political insiders and for people who actually need to know what is happening at the legislature every day. Whether it affects your business, your stakeholders, or the health and safety of your family, Queen's Park Today is tracking the ongoing developments in Ontario. The newsletter lands in your inbox first thing every morning, so you can start your day already ahead of the game. During a crisis, the importance of governments increases dramatically. The only way you can really get the detailed boots-on-the-ground coverage you need is by subscribing to Queen's Park Today. There's also BC Today and Alberta Today, which are great for people who want to know what's going on out west, but don't have the time to follow it closely. To get a free 2-week trial of Queen's Park Today, BC Today, or Alberta Today, go to politicstoday.news and hit the free trial button. That's politics.news/free trial. politicstoday.news/free trial. All right, we're here with Scott Reid and Jenni Byrne, my favorite co-panelists, back for a second week in a row in the midst of a full-blown crisis. So it's been a week since we talked, and it's been a week since we've all been inside the house. Jenni, how's your mood?
Yeah, I'm okay. I'm going a bit stir crazy. I am a very social person. I like to be around people. Like most times, most weeks I'm out for dinner 4 or 5 nights a week. So there's just been a lot of video chatting. So I've talked more on the phone.
Are you doing that with friends and not just work? You doing it with friends?
Yeah. No, I'm doing it with friends and family. Yeah. Even my dad's even on the video chat. So.
Excellent. Scott, how are you?
I've gone to seed, like, as you can see, it's like 8:00 in the morning. I'm still in my bathrobe, my Expos jersey. This is what I'm going to wear all day long. I'm drinking.
You're wearing your 2003 swearing in uniform.
That's right. That's exactly right. Adrian Clarkson has advised Canadians that they should get up, that they should shave with a straight razor, put on a frock, and serve a formal dinner. Fuck you, Adrian Clarkson. Fuck you. Okay. I haven't shaved. I haven't showered. I smell like a car seat, and I don't care anymore. I just don't care.
How are you doing, David?
I'm okay. I'm like you, Jenni. I don't really do well in isolation. I sort of need more social interaction than I'm getting. I've been worried about my business and working on my business. It's been a stressful time, I have to say. It's okay, but it's a stressful time. But God, for other people, much more so, because I recognize what a privileged position I'm in to ride this out. If you didn't have any money at all, this would be a very disconcerting time.
Yeah, I agree. It would be very, and I know we're going to get into it. For me, the other thing about this is I'm just eating all of the carbs. Like you throw a carb at me, and I'm eating it. And I've really found that those Norse sidekicks, like butter and herb, they make a really good meal on their own.
Butter, you can't go wrong with butter.
They have like
I eat straight at the fridge. I've quit preparing things or even removing them, right? I just stand with the fridge door open. I don't bother with my hands. I just lean my upper body in and just kind of like a camel. I just sort of chomp on whatever my mandibles can reach. And I got one piece of good news, though. It's, I think, well, both of you know, I tested negative. So I'm very happy about that. So I do not have the COVID as of right now. And that's good. So I'm just a little afraid they're going to make me I don't want to do that test again. I know that we need to test everybody, and that's important for public health. But
I've seen diagrams. That thing's going up right under your eyeball. It's going so far up your nose. It's right under your goddamn eyeball.
It's in, and the doctor says this is going to be uncomfortable, but not painful. He said, I've not done it myself, but I wish to advise you that that's what I'm told. Uncomfortable, but not painful. And then he put it so far into my body through my nostril that I began to urinate. So I don't know what his definition of not painful is, but it tripped past my threshold. I can tell you that. It began triggering body functions that are not supposed to be involuntarily active.
Right. So I want to start this conversation off with a basic kind of question, because our last pod got a little bit of pushback, not just because of my ridiculous production quality. Got a little bit of pushback because we were negative about some things. And then, those of us who are on Twitter and commenting on the government's actions have gotten some pushback from the usual suspects if we weren't wholly unified behind the government's position. So I just want to start by asking you too, is this an appropriate time in the middle of a crisis like this to be critically assessing what the government is doing and to be critically commenting on what the government's doing? Or is this a time when we should all just be pulling together and saying kumbaya behind our leadership, because it's important that as a society we rally together? Well, can we actually have the conversation we intend to have today?
Of course we can. It would actually be irresponsible if people didn't question what the government is doing. It would be irresponsible for the opposition not to comment on what the government is doing. So I think it's the only people saying that are liberals, no offense, and liberal sympathizers who want no oversight.
Are we liberals or liberal sympathizers in your category? Because liberals themselves question that, I find.
Okay, well, so
no, I don't think the PMO questions it at all.
No, we're Vichy. They're like, are you full Vichy? Sure.
I think it's completely responsible. This is, I defended the government and their handling of things a month ago in terms of, as everyone was trying to understand the magnitude of what we were doing. But I think it is completely reasonable. And there's a whole host of examples as to why. Like, the liberals will say, oh, well, people are playing politics. Well, I think the only people playing politics in this whole situation from start to now have been the liberals. If you go back to when the Americans closed their borders, which was close to a month ago, it was Justin Trudeau who said, we're not border closures are ineffective. This isn't going to be knee jerk. I think it was a very political decision that the liberals sent 16 tons of medical supplies to China on February 9th, a good 10 days after the World Health Organization warned countries that there was a serious pandemic and that they should be prepared. He did that, of course, for his Security Council election. So I think that the only people playing politics are the liberals, and they just don't want any scrutiny.
We're surely not the only people, because the Conservative leadership candidates have been making political commentary all the time. But you are saying that the government itself has been political in the way it's handled the crisis.
I think in some ways they have been. So I think they have to expect it's irresponsible. Yeah. It would be irresponsible for the media, for citizens, and for opposition politicians to not question the decision that their government is making. This is huge. It's people's lives and basically the economy of like the entire world that is at stake.
Right. Scott, we have gotten some pushback from what Jenni would call liberals or liberal sympathizers on social media for being insufficiently supportive or certainly excessively critical about the government, as we felt that they were slow getting their economic package together. And so I put to you the question I put to Jenni: is it fair ball for us to be criticizing government right now, or is this, because it's a crisis, a time when everybody needs to be just pulling together and being supportive?
Yeah, I think it's a question of tone and how you characterize things. I don't think people have much tolerance for pure politics, for partisanship, for bullshit. But I think you got to be in a place where people are permitted and are encouraged even to say, here's where I think the gaps are. So I think it's a tone thing. I think if you say, I'm not calling everybody evil. I'm not suggesting the government's ill-motivated. I'm certainly not suggesting that people aren't working slavishly, hard, desperately hard, as we heard Scott Clark say. But I think you got to be able to say, here's what I think should have been done sooner, should have been done different. If you don't do that, then I don't know, whatever. Then I guess we all just watch Tiger King and say, fuck it.
Well, I mean, in terms of being
awesome,
supportive,
it's awesome. It's the greatest thing. I mean,
is it really?
I'd make a good leader.
I don't have Netflix here. I don't have Netflix where I am, so I can't watch it. But is it good, Jenny?
No, I have a strong stomach, and I usually like that stuff. Like, keep in mind, I'm someone that I've actually been seal hunting, like in the North Atlantic. I have a hack-a-pick that's like in my living room. I found the first episode so disturbing. I have not watched the rest of it.
It's a gay gun-toting redneck who raises wild cats and has a polygamous buddy. I just don't know, and is polygamous himself. I just don't know.
Only in America, literally only in America.
Yeah, it's Trump's America, that's for sure.
Anyway, the government introduced a big, bold economic package that is exactly what you and I have been calling for. Not that there's any relation between those two things. I'm not claiming any relation between those two things. I have picked my ideas up off the... I'm sure it was us too. But nonetheless, I'm pretty happy with it. It sounds like it's, and according to Scott Clark, it's as generous and robust a package as exists anywhere. And everybody should find some comfort in there that they can keep going through this period of time. Scott, would you have any different point of view about it?
I'm a big fan of it. It does what, as you say, for 2 weeks, I've been arguing these are the measures we need. I like the moves by the central bank to keep commercial paper flowing so that people can meet payroll and all that stuff. I like the personal payment to, self-employed, all the other folks that fall through the cracks. And I love the wage subsidy. My fear is this. The reason for the wage subsidy is to avoid mass layoffs, to avoid stressing out EI, to avoid stressing out individuals. I think what they did is impressive. It's comprehensive. It's, I think, probably as a package better than anyone else in the developed world. I'll be really interested to watch how it operates in reality, because does timing matter so much that people say, I've already reconciled myself to layoffs, so I'm not going to undo those? Do people say, you know what, I'd rather protect my bottom line by not taking the subsidy and just laying people off? So I think it's a great set of policies. I completely applaud the government on it. I've been calling for it, so I got to say that. One wonders how it will work in real world now versus if it had been implemented 2 weeks ago. But thank God they did this. I think it's the right call.
And they made it retroactive, and they're encouraging employers to hire people back that they've laid off, and they will qualify under this program. And any employer who keeps their employees around is going to be in a better position to take advantage of any opportunities that ever exist again. So, I mean, in terms of coming out of this thing, you'll be better off as a company if you manage to try to hold it together, I think.
I think that's vital.
So I'm optimistic that employers will take advantage of the program. Jenny,
I'll just add one quick thing.
Jenny, how does it?
I just think that's really vital. When we aren't going to come out of this thing like it's certain like hibernation and all of a sudden, boom, everybody goes back to normal in 1 week. Restaurants will still have to social distance. Only half of employees will come back. It'll be a graduated thing. Maybe there'll be some starts and stops with it. So maintaining that relationship with employers, man, it's going to be vital, because this thing is going to be like a months-long enterprise once we're on the other side of it.
Yeah, I generally agree. I think it was.
How do you feel about it, Jenny?
Yeah, I generally agree. I think it was. I think it was a good policy to bring in. I'm kind of with Scott. I think the wage subsidy would probably have been better brought in a couple weeks ago before the massive amounts of layoffs happened. I think that, though, in the CERB program, the income support program is generally good too. Like Scott, though, I think the devil will be in the details. There's still a lot of information, including on the wage subsidy program, the wage support program, that we don't know. Businesses are still waiting to find out how they can apply if they're eligible. So I think the devil will kind of be in those details. And I also think people are waiting for the application process for the income support program, which the government is saying is another couple of weeks. So I think it's I think it's generally good policy, but let's see how it's actually going to be implemented and rolled out, because I think people generally, like this week, rents are due, mortgages are due, cell phone bills are due. I think that, it can't be, the government's going to have to step up their game. It can't be, the slow processing of like EI applications. People need real support. Businesses need real support right now. They don't need it. They can't wait until May or June for this.
So Dave, can I add one thing?
Do you think provincial government should be doing more? Do you think provincial government should be doing more on rent for people? I know there's a lot of anxiety about rent right now.
Well, Scott, do you want to? I know you wanted to say something. Do you want to say something, and then we can talk.
Yeah, the only thing I would add on the federal measures we saw is that I hope people don't get in a twist. One criticism I hope we don't give a lot of oxygen to is that a bunch of people who don't deserve it are getting it, or that there's there are perversities that come with it. There are going to be perversities that come with it. This is a sweeping, almost instantly created and executed policy. There will be people that take advantage of it. They're shits to do so, but that will happen. There will be moral hazard. So, I mean, let's not get, I just hope we don't have 3 weeks of people talking about that, because you know what? You got to pick which problem you want to fix. You're going to create some of those perversities and abuse problems, but that's got to matter less than fixing it as much as you can for most people. So that's just the one thing on fair criticism, not fair criticism. I hope we don't get a big litany of that crap.
Well, and I would just like to say, and I know this is partisan, but on the federal stuff, I thought it was particularly galling. This is where people are watching this rollout of seemingly these programs as communications exercises, which I think is a mistake. I thought it was particularly galling that the Prime Minister came out today and said, basically, we're able to all do this because of spending restraint. This is rainy day spending. Like this spending the Liberal government did between 15 and 20 between now is the highest outside of a recession year than it's ever been. Like they didn't pay off the debt. They added $70 billion to the debt, and this year we're going to have pre-COVID a $28 billion deficit. So I just think it's very galling. If it's, people are supportive of these projects, and some of these programs went through the legislation, which were supported by the Conservatives and the NDP. But I think if the Liberals are sitting there believing their own spin, that's going to be a problem.
Fair enough.
Jenni.
That's
Jenni.
But it's small beer.
It is not fair enough. It is not fair enough. What the Prime Minister said, you and Andrew Coyne can be called if you want, but what the Prime Minister said...
it's not like Andrew Coyne is good to me.
It was like, the Prime Minister said Canada over a number of years had made wise financial decisions that put it in this place. So he was obviously including a stretch of time that charitably included your government, given its fiscal record. He wasn't claiming credit for himself. He was saying that Canada, because of the last quarter century, was in a pretty good position relative to other people to do it. So I think that was... So
he really should have given credit to Paul Martin and John Chrétien and Stephen Harper, because it's not that Canada was in that position for any decision that he's made over the last 4 years.
Well, that's not true. That's not true. That is not true. Because if you want to have it that way, why is the fiscal capacity so high? It's because GDP is strong. It's because unemployment is so low. And I think that he can claim some credit for policies that have helped to boost employment over the course of the past 2 years. And that, if you want to talk about, the two variables in this equation, that's the most important variable when it comes to GDP capacity or fiscal capacity, and GDP as a function. So,
all right, Jenni, I want to loop back to you though. I want to loop back to you, Jenni, and I want to ask you how comfortable you are with such a big government approach. This solution is the most interventionist thing that's ever happened in Canada. And I don't sense a lot of pushback from small C conservatives in the country about this kind of approach. So is everybody of all ideologies just accepting that in this circumstance, this is what you need to do?
Yeah, listen, I think, as I said, it's going to be interesting to see how much these programs actually cost, how they're implemented. But this is such a, like, people still say it's surreal. This is such a circumstance around the world from both a health perspective and an economic perspective that I'm not sure there's any other way we can, any other government would do anything different. So I think that, I still truly believe that the Trudeau government should be questioned on certain things, but I don't have any. At this point, I think the wage top-ups and the income support programs are necessary.
It's a super question.
Yeah, go ahead, Scott.
Well, it's just super interesting. I know this is kind of bullshit, but our thing is politics. We all love politics, and it's unknowable at this point. But let's cast our mind forward 6 months, 8 months, 12 months. Which will be closer to the truth? Political and public appetite will demand governments that take swift action to reduce the huge deficits and reduce that to a moment in time, and those policies were addressed to a moment in time. Or will you see a public and political attitude that says, hey, you know what? We have to continue some of these policies. We have to maintain our fiscal situation like it is. We got to have bigger deficits just to help us get through this. And does that then create a crisis for one part of the political spectrum, which campaigns and is founded basically on, to the degree to which we can, let's lower taxes and have a smaller set of government. Which one of those two worlds? Is it going to be like where people are going to be like, no, we need government to get pulling that belt in? Or are people going to be saying, we need government to think about which of these things we preserve? And we don't know yet. That's going to be a super interesting debate and development.
It will be an interesting debate because we just don't know where the world is going to be. Like, we're in a position where, the Olympics in July have been canceled. Germany's talking about canceling Oktoberfest. So I think that if
far.
Pardon? Too far. The bridge too far. So I think that to what, Scott, your point that you made before, I think the world as we know it will be a very long time. The world as we knew it will be a very long time. I agree with you. There are entire industries. This isn't going to be like 2008 when there were business losses across the board in North America. But for the most part, people might not have gone out as much, but restaurants weren't fully shutting down. If we're in a position where there is no NBA, NHL, or Major League Baseball next year, like, think of all of those restaurants and stores and shops that are like on Front Street. Like, it's the domino effect of what is going to happen will probably make it necessary for certain programs in the next 6 months to be necessary.
But the government's all governments all over the world are going to be unbelievably indebted when this is over. Unbelievably indebted with this. So on the old rules, I don't know if the old rules are going to apply, but on the old rules, it would be years and years of hard austerity that would have to follow this in order to get back to the. Well, if you have $200 billion deficits for 2 years in a row,
except they're
right,
not,
you're back up to.
The debt will stay with you. The debt will stay with you, but is it true that, I mean, you could see a radical reduction in the deficit. It might fall to 30 or 40 or 50 billion, like in the first year that you've decided those measures aren't necessary. If you roll those measures back, you're going to see an enormous drop in the deficit between 1 year and the next, whether that's the second to third year or the third year.
We're all just guessing about how the economy comes out of the coma that Scott Clark said had been put into, right? If it comes out roaring, that's fine. But presumably it comes out a little groggy and uncertain. So I don't personally anticipate that these measures are being withdrawn super quickly.
Yeah.
So I just don't know what. I assume that there's going to have to be, frankly, some different international approach to managing government debt because government simply won't be able to be as constrained as normally this financial picture would make them, I don't think.
Well, by the time we're permitted to return our empties again, I'm going to be one rich motherfucker.
When I worked on the listeriosis file with Maple Leaf Foods, I met a guy named Peter Sandman, who's a internationally recognized risk communications expert. I learned a lot from him, but one of the things he told me is, if you're supposed to be the authority on something for people, if you want people to look to you, one of the things is you never, ever say anything that you don't know to be true. You don't guess, you don't hope, you don't presume, you don't do any of those things. You don't say it if you don't know it to be true, because if it turns out not to be true, it completely undercuts your credibility. So I raised this in the context of a couple of things that have been communications from the Government of Canada. One of which Jenni referred to earlier, which was the border crossing issue. And the government did respond quite politically to the notion that borders should be closed when it was proposed by the Conservatives and others. And now we say that border closures are important and an important part of our response to this. And since we first started hearing about this thing, we've been told not to wear masks. We've been told that masks are unimportant to us, that they wouldn't be helpful to us. And now there seems to be a growing consensus that anybody that could wear a mask probably ought to wear a mask, either to protect themselves or to protect them from transmitting the disease. How do you think, Jenni, is that going to have an impact on the government's credibility as they go forward on this? And I mean, I'm particularly, I have to say, a little personally put out about the mask thing, because I don't feel I was treated as an adult. If they had said to me, masks are on balance helpful to your health, but we need to save them all for healthcare first responders, I'd have got that.
100%.
Right? But they didn't say that. They said you don't need it. And that I feel a little bit lied to about that.
Well, and I think this is the issue, and I'm not sure how much people are paying attention. I assume we're talking about Theresa Tam, the head of the Public Health Agency right now. I'm assuming, because
right.
She's the one that has continually said over the last month and a half that masks are not necessary. They won't prevent the disease, or prevent getting the virus, which makes no sense. I'm with you. I get why people shouldn't just buy up masks because our first responders and our nurses and our doctors need them, but logically, that makes no sense, because then why are doctors and nurses and first responders all wearing masks? They're wearing masks so they have a less chance of getting the virus. So it's a complete misrepresentation. In fact, she was repeating it as of yesterday. And so I think the issue that Public Health Agency has and the government has with Theresa Tam is that I worked with Dr. David Butler Jones and the late Dr. Frank Plummer during the H1N1 pandemic in 2009, and they were consummate professionals. And they were every day they went out and they talked about the progression of the disease and what was happening, and they answered scientific questions. Unlike her, who has made these pronouncements that aren't true, as well as not let's not forget, she was commenting on the effectiveness of border closures as well. She called border like a month ago that they were ineffective and they had racist overtones. I don't understand why Canada's top doctor is weighing in on issues that do not pertain to any of the scientific progression of COVID-19.
I'm not as hard-assed about it as either one of you, I think. And I don't think most people are either. I think that I think to the rule that you were expressing, the principle on public communication in a time of crisis, coming from the professional that you cited, David, I think that there's an important asterisk to that, which is that people are entirely forgiving of information that may be communicated not falsely, but unknowingly. So if people are saying, this is what we believe to be true now, if it may change later, then that's one thing. And I think most people would place most of the issues, notwithstanding what Jenni just said, into that category. There will be a re-examination of all of these things. What will happen inevitably, and it may not have to wait right until we come out of this thing, it may happen sooner, but at some point, media will start to go back and they'll start to scrutinize statements and say, what is the relative distinction between things that were said that could not have been known and that were said incorrectly, but forgivingly, versus those things that people knew to be incorrect, they said anyway. And of course, all of this gets distorted as a measuring stick because anyone who's short of an absolute lying sack of shit pales in comparison to Trump. So he alters the scale on this on a daily basis, right? He's so full of fabrication that people sort of regard everything else that might not be entirely accurate as a forgivable misstatement or so. I don't I'm not even Trump delusion syndrome. I don't. The whole world wants to be fuck off.
Derangement syndrome is actually what you have. But we're not talking about a politician speaking. We're talking about the head of the Public Health Agency of Canada, who consistently said for a month, starting in January, that there was no worry to Canadians. Canadians have a very low chance of ever of getting this virus. That ultimately at the same week, the World Health Organization was warning countries that this was going to be a global pandemic.
And the WHO was saying at one point that it now doesn't affect people that aren't seniors, that it doesn't appear to be as virulent among those countries that are more tropical or that higher temperatures. I mean, so, I think most people will cut slack on that stuff. I'm not like, we're allowed to criticize people. We've established that, I think, maybe more forcefully than others have. But I'm not prepared to take out my bow and arrow and point it at Dr. Tam. I really am not.
Well, they doubled down on her, Scott, and made her sort of very much the spokesperson because she's featured in the Government of Canada advertising.
Which is ridiculous.
Well, how come? Doesn't Government of Canada advertising really slide over into a PSA now? And if it is PSA oriented, shouldn't you have the professional, not the politician, fronting?
Possibly, but I just don't. I don't like. I think she should go out every day and just state what the facts are, and what Canada is doing to prevent the spread and what have you. She has turned herself. This government has turned her into like a political face, and I'm saying I don't think she has the credibility to actually be that political face, and nor should she want to be. I'm actually shocked she wants to weigh in on these issues.
Scott, you think she's an effective spokesperson for the government?
Yeah, I do. I mean, I think that there are probably some gaps here and there. I think there have been a couple of very slight missteps. I think
she was saying as of yesterday, the masks weren't necessary.
Yeah, I think the mask thing is something that we'll scrutinize. But I also think it falls into the category of information that's forgivable because people look at it and they go, well, it's a dynamic situation. Do you wear a mask? Like, I can tell you when I went to get tested, they gave me 3 masks. They told me to wear the mask, not to preserve myself from infection, but to ensure that I did not infect others if I came into contact with anyone. And I think that's been her general guidance, and I think that's been the guiding rule forever. Don't waste the mask. We also live in a world of scarcity. Don't waste the mask if you're just walking around your dog in the neighborhood as a matter of precaution. If you think you're infected, then wear the mask so that you don't harm others. But other than that, let's preserve them for health professionals. I think
if you think you're infected,
well, that's not what was said. That's not what was said. What was said was you don't need it. It's not useful. It might be counterproductive to wear it. You might be more likely to get it if you wear it, is what we were told. So I just feel a little bit like I wasn't treated as an adult on that. I wasn't allowed to make the decision. On the ads, I'm just going to say I think they're lousy communications. I think they're lousy communications for the target audience that appears not to be getting this message, particularly young men, right? Are among the least likely people to watch that advertisement featuring her, I think. So
I agree with that.
I don't have any problem with her. Yeah.
I agree with that.
So I went into isolation 2 weeks ago. Didn't know whether it would be 2 weeks, even as long as 2 weeks at that point in time. And over the 2 weeks, I've become accustomed to the fact that it may be a month. And now the United States is talking about the end of April. And maybe people are saying it could go longer. As these timelines for isolation get extended, how does the government's job change? And what does the government need to do to keep everybody functional and keep the society cohesion together in this, as we're 2 months inside of our house and the economy's 2 months on the ground? What does government have to do in that circumstance?
Well, I can go. I think that there is going to have to be more of an effort or a thought put into people's kind of physical and mental health issues that I think people are going to have as we're all isolated. We're all lucky to have networks and family and what have around us in terms of being able to talk, even if you're not with people. But I think that governments that are making the, like closing down parks and what have you, I can understand if a bylaw officer comes by and sees, 8 people sitting around together and they want to find them or tell them to go home. But I think closing parks, there was an example for a woman in Nova Scotia. She parked in an empty parking lot, had her dog, was walking in a public park down by the water, and she was fined $700 and they impounded her car. Like, I just think that governments are going to have to make common sense, especially as, with the Americans saying it's April 30th now, it possibly could be longer. And I just think that there's going to have to be decisions that governments make that give people a little bit of flexibility for their own health and mental health that over the next month.
Scott, what would you start writing for the Prime Minister if you were writing for the Prime Minister?
It's difficult to know because you got to pick the problem that's most important. And is the problem that's most important? There is a problem. And Jenni talked about this on last week's podcast. I joked around a little bit. It may have been too glib about it. But after another week of isolation, and we're in fairly strict isolation in this house, so you feel it. One problem is that people are feeling pretty fenced in, and it becomes difficult to maintain. But the other and the greater problem is that if we're not flattening the curve, and if we all turn into New York City, then restrictions will be even greater, and our freedoms will be even more restricted. And so right now you hear the Prime Minister every day saying, stay the fuck home. I think you gotta slay that dragon first. Get the health thing under control. If we're there in 3 weeks, then I think, we start hearing more from the Prime Minister on other issues. I don't know the answer to your question, David. Like, I don't know how in the midst of a sweeping public health pandemic, you can simultaneously try to help and manage people's mental health by saying, okay, here are things that you can do, and how much of that is the government's role versus how much of that is what we should be doing for one another. I think helping seniors, I think helping people who are vulnerable, trying to find ways to ensure that they're checked in on, facilitating, supporting, government incentivizing volunteer networks that make remote checks, start connecting people in old folks' homes to who are in a position to chat with people, to folks who want to chat with them, all that stuff. But golly, I don't know the answer to that question, and I do think that we're in sort of semi unprecedented territory. No one living, I don't think, has lived through times of.
Do Churchill or Roosevelt give us any guidance?
I don't know. I'm a big history buff, but I don't recall. It would be more pertinent. I mean, it wouldn't have much relevance in the United States because they were not restricted in their movements. London, during the bombing, people were restricted in their movements. But fear motivated that. The government didn't have to tell people to do it. The fear of dying, pretty active agent in their behaviors. I don't know. I don't know the answer, but it's a question that we're going to have to slowly turn to more and more, because it won't just be, as Jenni says, it won't just be about enforcement. It'll be about making it easier for people to follow the restriction and isolation rules. Otherwise, it will come unglued.
And that's what my point. I think that, municipal governments here, and I just use the park as an example because it's an easy one, and I think it actually is affecting people. I think by putting on restrictions and not letting people exercise common sense, because let's be honest, like we were talking about this before, you were Scott, you were talking about the assholes that will eventually take advantage of the new government programs, and that's true. They're always going to be assholes, but whether you close parks or not, like what you're doing is taking away people who genuinely just want to get out for an hour a day and not socialize with people. And to your point, I think that if all of these decisions remain too strict, and I agree with you, then I think and one day people are just going to wake up and say, you want to know something? Fuck this. I have got to leave my house and I don't give a fuck anymore.
Especially if they own a border collie.
Well, that's a practical. You're up there, Dave, right? You're in rural Quebec. Yeah. I'm in downtown Toronto, and I got a duck toter, not a border collie, but they're similarly athletic. He needs to be run. Walking him on a leash around the block, even for an hour, which happens 3 times a day, staying away from people, it's not the same as running him off leash. That dog needs to be run off leash. There are millions of people in situations like that, or something more important, that require open spaces. So how do you figure all that stuff out?
Well, we're gonna figure it out in the context of talking about the Conservatives. Jenni. What is happening with the Conservative leadership race? Can you tell us exactly what the fuck is going down?
Listen, I actually can't. So our leadership election committee, organizing committee, last week came out with basically saying they're suspending the race for till May 1st. Then they bizarrely announced that they were moving back the membership cutoff date from April 17th to May 15th, but left the date open-ended. So they said, we're not going to be able to go ahead with the election day on June 27th. We get that. So we're going to push back the cutoff, which is very bizarre to me because we've all been involved in leaderships and nominations. You do it back, like you pick the date and then everything kind of moves under that. So there are some people that I think we could still go ahead with the race. I don't know, based on I don't know how they could think that, but it's one thing. So the interesting thing, the feedback I'm getting from a lot of people on the ground is that they're like, all right, if we have to push this back to the late fall or even next year, maybe we can use this as an opportunity to reopen the and I'm glad we're making you so happy. So I'm not.
Oh my God!
I'm not sure that's on the. I'm not sure that's in the cards, but I'm hearing that more and more as people are becoming uncomfortable with Peter's campaign. And Aaron just can't get any traction. They're running a great campaign. My friend Fred Deloria is his campaign manager, and I think they've been running a great campaign, but there isn't traction there. So there's people that are like reaching out and saying, well, maybe this gives Ronna Ambrose or a Pierre or someone that has said no, Brad Wall the last time, maybe they'll step in. They'll step in. I also wouldn't have suspended campaigning. I would have said no events, obviously. I might have actually even said to them, you're going to suspend fundraising for a month because all the donations actually flow through the party. So I might have said to the campaigns, you're not going to fundraise, you're not going to do events. But like for me, I wouldn't walk across the street probably for an event for any of the leadership candidates. And I consume and talk about politics like on a daily basis, like 20 hours a day. But being stuck in my house, I probably would go on a telephone town hall or a video chat with all of them. So I think that the party should be a bit flexible in terms of that.
How much of a rebuke to McKay was the postponing of the convention? Because he had gone on a full social media jihad in the days leading up to that to try to urge the party not to do exactly that. And by the way, I think he spent a tremendous amount of political capital in the process of doing that because he looked ridiculous and self-serving. But so it felt like a real loss to him to have that convention postponed.
Yeah, I don't think it was a rebuke to Peter, and I actually think postponing doesn't help or hurt either of the two front runners, or perceived front runners. I think it was. I think that his team should have probably saw the writing on the wall. As I said earlier, like the Olympics is canceled in July. Like there's no way that the party was going to be able to proceed with a leadership convention on June 27th. It was never in the realm of a possibility. And that's why I think that they came to the decision they did. I still think it's bizarre that they've left this May 15th membership cutoff deadline when we don't even have an actual race, like an election day.
Scott, can we get a couple of minutes of stream of consciousness on the forced march through the looking glass that is the McKay campaign?
Unbelievable, eh? Wouldn't it be great to have been a fly on that wall as people said, no, I want to do this stupid thing. Not stupid enough. Do something do something catastrophically, historically stupid. Wait, you're not going to, I think I'm going to hit myself in the nuts with a hammer until to me, it's just astonishing. It's astonishing. There's one simple rule in a crisis like this. One simple rule that any fucking couch cushion is smart enough to know, and that is appear to be focused on the public's business, not your personal business. And Peter MacKay, and frankly, the whole Conservative race, and even this notion of, well, we could still be campaigning in some respects, all of it signals that the priority is misplaced. And that's what was so terrible about his public campaign to extend the campaign. It just said to people in a million ways, loud and quiet, this guy's focused on the wrong thing. He's focused on his own position. Well, congratulations. He's the winner. He is now mayor of Big Tit Island, and there are no other. He's the only one, okay? And I think it's done severe damage to him. Either it will hobble him when and if the race, when the race is resumed, and people will be clamoring for an alternative and saying, let's reopen this whole thing, or it will mean that he sits on his big lead, it resumes, they go through the formality of picking him as leader, and I think he's done permanent damage to himself as a political brand, because reminding people, he wasn't Churchill, he wasn't Churchill in this moment. He wasn't even Halifax. He wasn't anybody, man. He was just ridiculously self-involved. And I like the guy. Like, I like him on a personal level. I know him very casually, but he's not a bad guy. But boy, Jesus Christ, he's run a bad campaign. And on that critical moment with the spotlight shining bright, he was as bad gets. And it was just a disaster for the Conservative Party, given that he is their front runner and most likely next leader.
Well, I'm going to have to leave the last word to Jenni, because it can't end like that without her having a chance to respond. What do you say?
Well, listen, the concerns that I'm hearing from people is kind of what Scott was alluding to, or not even alluding, what he said, is that although right now, if the race stays the way that it is, it's probably likely that Peter will still win. That these comments and missteps aren't going to affect him in the leadership race, but it's indicative that as people are worried as to what's going to happen once he's leader, and has missteps that are potential missteps that could be of greater magnitude that matter to people. And of course, the Liberals will seize on that. But I think that, listen, this is one. I think the race is going to be put back. I think the party has no choice. I think the fall will be the absolute earliest that this race will be. So there's a good 6 months for people to get their shit together. And that includes the leadership organizing committee.
Well, as they should, because as Scott said, there's been a million brutal, stupid mistakes in this campaign, and none of them as a result of pressure. All of them self-inflicted, without any pressure, without any force. So he is proving to be, as I thought he would be, a weak candidate. And that is it for this week. I want to thank Scott and Jenni for joining us again on the panel, and we'll be back again next week. And I want to thank all of you for listening, and hope that you're doing well out there. And my God, anybody that has loved ones in old folks' homes or in long-term care facilities, my heart is with you right now, and it must be a very traumatic time. I want to thank our presenting sponsor, TELUS, and our sponsor, Queen's Park Today, and all of the Air Quotes Media people and Orange Lounge technical people who always help us with this. And I want to do a special shout out to Jill Engelman, who is putting in a tremendous amount of work and hours and logistics and pulling together these remote things for us. So thank you, Jill. And everybody, will be back next week. And for now, it's the Herle Burly.